It's another important tool for detecting breast cancer. Breast MRI is a non-invasive and very sensitive way of detecting cancer using magnetic resonance imaging.
Breast MR is mainly an adjunct to the other diagnostic imaging tests that we have, mammography and ultrasound being the two most important ones. And so we often use MR to clarify a finding that we have seen on the mammogram or on the ultrasound.
Recent recommendations from the American Cancer Society suggest that many high-risk women should be routinely screened with breast MRI. This includes women who have a 20 to 25% lifetime risk of developing breast cancer based on common risk assessment tools such as the Gale model. Women who have tested positive for a BRCA gene mutation or who have a first-degree relative who has tested positive should also consider screening. There are other indications as well, and that's why it's important to discuss risk factors with your doctor or specialist.
The best route, in my opinion, and this might vary depending on to whom you're talking, is to discuss with their primary care physician, if they are at high risk, the possibility of seeing a breast surgeon, because the breast surgeons are going to be the ones that are best educated in this arena, and they're also going to be the ones that can make the best clinical decisions about what next imaging study should be done in the appropriate clinical setting.
Experts say a breast MRI is most effective and convenient when it's done at a center that offers MR-guided biopsy, such as the MUSC Hollings Cancer Center. That way, patients are not going to multiple locations and receiving repeat studies.
The procedure for that is the same as it is for the MR. We still put you prone, and then we put against you a grid that will allow us, once we see the enhancing tumor, to know which hole in the grid to go into, and we have computers and computer-aided diagnosis that can help us with the depth at which we put the needle, and then we take a big swath of tissue in the area of the enhancement.
Breast MRI does have the downside of false positives, and that's why only certain women should be screened. Still, it can be invaluable for detecting early breast cancer in high-risk women.
We know from the studies that have been done that the earlier that one finds breast cancer, the more likely it is that the person can be treated appropriately.
If you have any questions about breast MRI or breast health, call MUSC Health at 792-1414. You can also find breast cancer risk assessment tools on MUSCHealth.com.